close to the screen.
No, I'm serious.
All right. Couple of things, just a little housekeeping. Apparently, the Canvas ability for you guys to make appointments with me is not working. I had a couple students meet with me this week that I was not aware of that they were coming in. Because what's supposed to happen is you pick a time frame to come and meet with me, and I'm supposed to get a notification even in Canvas. That's not happening. So if you have gotten a email from me with my signature at the bottom where it has all my credentials and contact information, at the very bottom of that, it says click here to make an appointment with me. That will take you to another page where you can see my availability and we'll be able to meet with you. Okay, you just select a time, put in the requested information, and then I know I'll get a pop-up on that one. Okay? So I will be, if you haven't gotten an email from me so far this semester, good job. No. But I will be posting an announcement about that later today. Okay? So that way I know everybody has. Okay, mister. All right, perfect. All right, any questions about that? All right, did everybody have a good weekend?
What? It's Thursday.
Well, I mean, I haven't seen some of you since last week, Mr.
You
Bontrain.
didn't ask us that, though.
Oh, that's because you were group number 1. You were already entitled. You got to see me first at the beginning of the week.
Yeah, I remember.
All right, so we are going to be talking about head, ears, eyes, nose, and throat today for your assessment, okay? One thing you definitely will need is your pen light, not today in class, but in lab tomorrow as well for group number 2. But you will also need to have a very well understood knowledge of the cranial nerves, everyone's favorite, right? So I have a nice little handout here for you. For group 2, you'll get an article tomorrow in lab to kind of help with that as well. Kenny, did you have a question?
I don't see the PowerPoint on Canvas.
It's on there.
Nice. It
I
is.
see pain management. Refresh it.
Refresh it.
Can you refresh it?
Because I fixed it just a few minutes ago.
For the 10th time.
Nice. Good handout, I like it.
Thank you. We have actually Professor Condon to thank for this one. I like color. I've seen this, but could never track down the digital copy of it. But Professor Condon has it, so she made it available to all of us.
Alex,
So,
can I get one?
all right. Now, I will say, you need at least a basic understanding of your cranial nerves for this upcoming test. When we get later on, when we start doing neuro assessments, you will need to know them backwards and forwards, if they're sensory, if they're motor, if they're both, and how to assess for each one. Okay?
So you need to know some of them for the test, most of them?
Be comfortable with at least the order
Okay.
and their functions.
Okay.
Okay? Lots of stuff goes into the head. Some people will call it a HEENT assessment. I just call it, head, ears, eyes, nose, and throat. All right? So, lots of stuff. We are looking initially for your inspection, of course. First, you always want to look, right? What's next after looking?
Hygiene?
Touching, or us nursing professionals call it palpating. Okay. What else? Are we going to need to listen to anything at this point?
Yeah.
They will.
They will. We won't. We don't need to auscultate anything. There's nothing to listen to up here for us as the provider, okay, or the examiner. There will be testing as far as hearing is concerned for them, but that's it. Okay. Let's see. Do you want to work today? There we go. So yes, inspection, palpation, percussion if we need to. We can percuss like the frontal sinuses here, okay? But percussion is tapping like this, okay? Palpating is just feeling and assessing for what? What do you think? well, that's the area, but what are we doing this for? Tenderness, pain, discomfort, okay? And then auscultation, of course, we know is listening, okay? Your tools will be your pen light for sure. You should always have your pen light and what else? Stethoscope, okay? These other ones, otoscope, ophthalmoscope, okay, that's, the otoscope goes where? In your ear. Ophthalmoscope? For your eyes. Typically, it's utilized more with advanced practice nurses to evaluate the retina and the optic nerve on the back of the eye, okay? And as well as blood flow. Tongue blade, that's a nice little tongue depressor. Okay, stethoscope we got. Why are we going to need a cup of water?
When you test for thyroid, how should you like watch it?
Right church, wrong pew. Okay, we need the cup of water to assess for swallow, not for thyroid. Okay, what we're looking for is the movement of the Adam's apple. And ladies, yes, you have an Adam's apple. It's just not as pronounced, even though I really don't have one that's pronounced. Of course, my voice isn't very deep either. But it's with men, typically it's a little bit more pronounced than women. But you have one, it's your trachea. Okay, gloves, of course. And what's that last one? Anybody know?
Like this.
What does it test with your eyes?
Vision.
It's your vision. That's the one that the big E at the top that anytime you've gone to the eye doctor, they're like, can you read me the smallest line you can see? Okay, that's the Snellen chart. There is another one, it's very similar, and the only thing that's different about it is the fact that it's handheld and you hold it at a distance. It's called the Rosenbaum chart. Okay. All right, so head, neck, and throat. We are gonna get, this is gonna be fun. All right, so we all know what the purpose of the skull is, I would hope. But there are 4 major bones of the cranium that you do need to be familiar with. Those are the frontal, the parietal, occipital, and temporal. Okay, so the parietal is on either side here, towards just above the ear, okay? Then we have the, come on now, temporal bone, which is right around here towards the base. And at the tip, we talked about this yesterday in lab. Anybody know what this is right here? Mastoid process. That's that nice little hooky bit back here right behind your ear. Okay. Your occipital bone, back here, so this whole side. And then the the frontal bone. Big old forehead. All right. We're going to want to know if they've had any head pain or frequent headaches, jaw pain, okay? Neck pain or stiffness, any neck masses and where they're at, okay? There's a lot of things happening from below the jaw to above the clavicle here, all right? What all is in there? Think structurally, go back to A&P. What's structurally in the neck area by itself? You have your trachea, you have your esophagus. Okay, what else? We have muscles, we have bones.
Thyroid, parathyroid,
We have the thyroid and the parathyroid. We also have these lovely little things here.
lymph nodes.
Before, I was thinking before that, but lymph nodes are in there as well, but specifically right here. They're glands. Do you guys remember? Your parotid glands. Your, like, the ones that you can like peel your tongue back and gleek with, you know? Do not tell me nobody in here has ever done that.
I did it in someone's mouth by accident one time.
That's disgusting.
I'm glad you're in the middle row.
I'm gonna move up there, don't threaten me.
All right, nasal congestion is a big thing too. Epistaxis, do you guys know what that is? I know group 1 does, so zip it.
Nosebleed.
Nosebleed, okay? That's the fancy term for a nosebleed. Mouth lesions or mouth and dental pain, so if they've had, even if they're missing teeth, okay, we're gonna be evaluating that. During the demonstration tomorrow, I'll have you guys open your mouths when you go, ah, okay? And you are checking all of the structures within the mouth, the teeth, the gums, the tongue. seeing if there's any caries or sores or anything like that in their mouth that you could possibly identify, okay? Or if they've had any implants in their mouth. Can you think of any?
Wow.
Fillings, crowns,
Root canals.
all those fun things. Root canal, all right? Sore throat and hoarseness. Typically when somebody has a sore throat, it can lead to what? If it goes left untreated?
Ear infection?
An ear infection, okay? Now, how does it go from the throat to the ear?
Eustachian.
Your eustachian tubes, okay? Those are the same tubes that are utilized to help when you've ever been on a plane and you get that pressure on the outside. There's a reason why they give you drinks and peanuts. It's to help you, encourage you to swallow and help equalize the pressure on either side of your tympanic membrane. Okay? We're going to inspect the skull or the cranium. We're going to look for the size, shape, and symmetry, okay? You might have somebody who has what's called acromegaly. Anybody ever heard of that term before?
Yes.
That's where their bones are still growing after like growth plates are supposed to have stopped allowing for growth, but they might have more pronounced facial bones, specifically here around the eyes, the cheekbones, the nose might become larger, the jaw becomes pretty big, okay? Gently rotate fingertips down the center of the scalp. So, we're not having the patient do that. That's us, okay? That's what you get for sitting in this front row. But yeah, you're gonna go like this and kind of feel around all of the cranium for any like, not so much like phrenology. Okay, you guys remember that from psychology class? I hope. No? It was the study of personalities based off of what the bumps on the head showed. It was a stupid science. It was discredited a long time ago. But you are feeling for lumps and bumps. But typically what you're feeling for is any deviations. So like me, I have a dent in the back of my head because when I was a kid, I was leaning back in a chair and my sister went, and I hit the back of my head on the refrigerator. So you might feel something like that. And if you find something unexpected, what do you think you need to do? Ask, what happened here? Okay. Normal cephalic just means they've got an expected cranium. It fits the size of their face, it's not larger or too small. There are times when, specifically more so with babies, when they're first born, they can be what's called acephalic, which means they do not have but just the face. This whole part of the head is not formed, and they do not live past birth. Okay. Let's see. Next. All right, with the neck, we are going to, of course, inspect it, palpate it, and I kind of lied a little earlier, but we do need to auscultate. Anybody know what we're going to auscultate in the neck? Not thyroid so much, but you're close. It begins with a D. Your carotids. You're going to listen for a whooshing sound. Now, that whooshing sound, does anybody know what that is called? Starts with a B. A bruit, okay? In the carotids, you want a bruit sound, okay? Because that means that there's adequate blood flow going through them, okay? There'll be other times later on you will find you do not want a bruit to be forming because that typically means that there's an aneurysm or something going on, okay? We're going to look at the positions of the neck, so we want them to flex the neck. So when you flex, you look where? Down. These muscles are engaged, they're tightening, so they're going to bring the head down. We're going to do extension, which would be lifting it to just a regular, comfortable level from that. Hyperextension. What movie is that when they're like, beam me up, or something like that? Okay. No, well, Star Trek was Beam Me Up, but there's one where they go like this. Mighty Morphin Power Ranger? I don't know. I'm showing my age now. But, and then lateral flexion. Gesundheit. What's lateral flexion? Valley Girl. Oh my God. Okay. Ability to swallow. Just have them, if we have a cup of water, great. If not, is it really difficult to swallow? You just have them. And you're just gonna palpate right here, okay? Now, I did tell you guys to not palpate what at the same time? The carotids, those are further out, okay? We're feeling right here. So all you have to do, go ahead and swallow for me. And that's it. You're just trying to feel that trachea move up and allow for that epiglottis to cover up the airway and then come back down and open up the epiglottis again, okay? There's different phases of swallowing with that as well. I would hopefully you guys, well, I'll go there. We are looking to see that the trachea is midline. So it's right in the middle where it's supposed to be. And I would expect everybody in here to know that for sure. Because if the trachea is not midlined, anybody know what that could indicate? Not so much JVD.
Pneumothorax.
What kind of a pneumothorax? Surprised you didn't raise your hand, Hunter. Tension pneumothorax. Meaning that the lung has collapsed to a point where it is putting tension on the other, like the structures of the respiratory system, and the trachea actually will move to the other side. Because there's that much pressure built up.
What's it called again?
A tension pneumothorax. Pneumothorax would be Pneumothorax. Okay. The person should be able to swallow their secretions. We do it all the time, we just don't think about it. That's why you don't have pooling of saliva in your mouth all the time, okay? Like speaking of which, now that I'm thirsty. They shouldn't be choking either, okay? Everybody here has swallowed wrong at least once in their life, I'm sure, by this point, right? But doing that on a continual basis can lead to what is called aspiration pneumonia. Okay? Not like aspiring, like I want to be an actor one day, okay? But you're breathing in foreign material into the respiratory system, where it does not belong, okay? And because of that, it produces makes the person susceptible to get pneumonia and infection in the lungs, all right? So unexpected findings, stiffness of the neck or limited range of motion. Why would we worry about that?
Meningitis.
Meningitis, typically, okay? Your entire brain and part of that, your your central nervous system, excuse me, is covered in a surface called meninges. And so if that gets an infection, it gets really irritated and makes the neck very stiff. So if someone's like, God, my neck is just really stiff and I've had this constant headache that won't go away, kind of should be like let's check your temperature and you might have to get them ready for a lumbar puncture, because that's how it's diagnosed. Okay. Detection of lumps. Stridor. Anybody know what that is?
High pitch.
It is severely loud breathing. It's an obstruction of the upper airway, typically by the epiglottis being inflamed, and you can hear it from the door. You do not need a stethoscope to be able to assess for stridor. It's one of those breath sounds, and it's super high pitched. If you have a kid who has bad asthma or any type of breathing difficulties, I'm sure I've heard stridor probably at least once. All right. We're also looking to see that there are no lumps or bumps. That's why we are going to feel for those glands up here as well. And of course those lymph nodes, because lymph nodes should not be palpable at all, okay? If it's palpable, that means it's inflamed. That means that there's been a long-standing infection of some kind, okay? So here's a couple examples. This is actually a goiter. It looks like a tension pneumo because this is their trachea, but it's actually pushing everything over this way. And then here's another example of a goiter here. That's where the thyroid is inflamed. It's producing so much thyroid hormone and the body's not recognizing it, so then it produces more, and then the body's still not recognizing it, so then it produces more, and it just builds up and causes a problem. Okay? Your thyroid gland, example. Okay? Now, when it comes to assessing for the thyroid, the best way to do it really is to get behind your patient at first, until you develop that sense of touch to where you can differentiate the different structures of the thyroid. In lab tomorrow, I will have you guys practice on each other with that, okay? We want to make sure that it's a normal size. What is a normal size for a thyroid? About the size of a walnut, okay? Main thing is, you know, if the patient has noticed any changes, or does it feel swollen or anything like that? Because honestly, they're going to know, they should know their body a lot better than we do. Okay. It is best to hyperextend the neck so you can get a better visualization. It's going to bring it forward because the neck bones are going to push everything forward a little bit as they hyperextend, and it's just easier to see. All right. All right, face. What do you think we're looking for when we look at somebody's face? Symmetry. They should have how many eyes? 2 at least, hopefully. Okay. God willing. All right. We are looking for anything asymmetrical or unequal in movements. So if one eye is blinking, you know, but the other one's not, is that an issue? Yeah. Our eyes are continuously needing to be moist. If they start drying out, then they stop, you know, it's not comfortable. It gets irritated and red and everything else. So we want to make sure to note that, okay? Going to inspect and palpate. Of course, the sinuses around the eyes, all the way around. Because you have frontal sinuses up here in the forehead, and underneath the eyes, just above the cheekbones. I mean, if you've ever been really congested and just you have a headache here and it feels like your eyes are going to explode, it's because those are filling up with fluid. Those are supposed to be air filled. That's why they're called a sinus. Okay. Looking forward, make sure have them smile. Do their what's called your FAST assessment. And I don't mean fast as in quick. You guys ever heard of a FAST assessment? Correct. We're looking for facial symmetry. Okay, so face. All right. Arm drift, so you'd have them stick their arms out like this if you're assessing for a stroke. Okay, and seeing if they have a drift. What else? Smile. We also have them do frown, checking for symmetry again. Okay, and then T in a FAST assessment is what? Time. What time did those symptoms start? Okay. So you also might notice too that for sometimes, or obviously more so with women because of a hormonal imbalance, hormonal changes, they might start developing facial hair too. Okay. Huh? She's like, that's what they make wax for. No. Well, if you're Italian, apparently it's just hereditary. You know, all Italian women have mustaches. Just kidding for any Italian women out there. Just kidding. All right, so we talked about this already. Have them show you their teeth. Look for unequal movements. No smile line. We don't think about it, but you know, we are constantly engaging these muscles in our face, and hence we get those nice little nasolabial folds right here. Okay. If those muscles are not getting engagement from the nerves or signals from the nerves, they go flat. So just like when you flex your arm, okay, your brain is sending a signal to your bicep to contract, and it causes it to flex, right? But if we're not getting those here, say from a stroke, because that part of the brain's damaged now, it's just going to fall and droop. Okay. Also, you can have them puff out their cheeks. just like that. Okay? Talked about fast already. Of course, if we are suspecting somebody of having a stroke, as healthcare workers, we need to get a set of vital signs. Okay? It could be related to, the blood pressure, or it could just be an aneurysm that popped so that their blood pressure would be okay? So we need to figure that out. The best way actually to find out if the patient's having a stroke, they have to get a CT of the head, okay? Because there's two types of stroke. Does anybody know what those two types would be?
Ischemic.
Ischemic and hemorrhagic, okay? Ischemic means there's a lack of blood flow to that section of the brain. Hemorrhagic is typically associated with an aneurysm where the blood vessels are leaking blood into the brain tissue, and therefore it's not able to get the oxygen and everything that way, okay? All right, we talked a little bit about the lymph nodes. Okay, we do know that, of course, they are the major part of the immune system, all right? We will go into this a little bit more in detail, how the lymph nodes work later on this semester. But for now, do know, of course, that they are used to filter out lymph and pathogens. And if they are palpable, that's a problem. Okay, usually if they should be expected to be like the size of a pea. They're not very big.